Hi everyone. This is my sixth talk on sixth talk of quarantine positive series. Today I will just discuss points, actually only 3 points that are very useful for treating morning sickness. These points you can teach your patient to even massage these points. They respond very well to massage or acupressure, so not necessarily needling. You can also use these points and send the patient home with press tucks, and they can hold them in for a couple of days, and it's very effective. Now, I wrote here morning sickness, but I'm mainly speaking about all types of disorders that come due to the first trimester of pregnancy, but also can go to sometimes into the second trimester and sometimes straight through the whole pregnancy. So these points are combination are mainly used for the bilious attack, the nausea, the constant vomiting, in general, all those, the heartburn, all those symptoms that are occurring in the GI tract. So these points are very useful treating it. So it's not also only necessary for the morning, but also throughout the day and throughout the day. With my experience with these points, I found them very useful on my patients that suffer from these symptoms. I a lot of times give them the points. I show them where the points are located, and them or the spouse can massage them, and they gives a very good relief. So it's very relief to the symptoms, and some of them slowly improve and find themselves again getting their appetite returning to themselves. So with that, like these general Yamamoto new scalp acupuncture method has 4 different categories of group needling group points. One of them is the basic points, which these 3 points come basically from the basic points of Yamamoto. Now, what's interesting about these basic points of the YNSA, each point treats a different area of the body. So when we keep talking here about morning sickness, a lot of times you're gonna needle them bilaterally, not necessary to go and do the whole diagnosis. So this is the first group of points. The basic points were the first group that Yamamoto discovered, and from that his whole system developed to the next 4 categories of points. Now, what is interesting that each point has a different area in which it covers and treats, so that's more important than the indication of the point. And what is important that it treats the body skin inwards, okay? It's like taking a CT, for example, if we're going to speak here about the E point, which treats the area of the thoracic spine, it's not only the thoracic spine and the muscles around the thoracic spine, or it's also the pulmonary system, it's also the skin in this region, it's also the esophagus, okay? It's also can go up to the area here, up here, and then with that you have that vomiting feeling, okay? So it will treat that. The same is, this is one of the points, which is E point, which you can see here, located on my right side. The next point is the D point. The D point treats any disorders from the diaphragm down to the feet. So it's also the lower digestive system. It's also the upper. It's also going to cover and treat the stomach, intestines, kidneys, bladder, lower abdomen, the ovaries and uterus, and etc. But also the musculoskeletal system and the lower extremities. That's the D point. Okay, now what's important that the combination between these 2 points, one of them is E, because a lot of time when you have that heartburn or the nausea, okay, you have the feeling up here in the upper area of the chest. So E point will calm that feeling down and also calm that feeling of the wanting to vomit, okay? Now the D point is going to calm the area of the uterus down and the lower abdomen, calm it down and relax it. So you also that occur in there of that whole development of the whole development in the pregnancy, the first stage of the pregnancy, you have a lot of chi basically there, and a lot of movement, a lot of development there happening, a lot of cells being developed, and you get that irritable feeling. So it's also going to calm that down. It's not going to stop the creation, but it's just going to calm it down so the symptoms won't be as severe. So that's the D point. The next point, which we don't have here in the drawing, is actually an area here, right in the area of the, between the eyebrows, is actually a throat point. So that actually treats the area of the throat. So treating the area of the throat will also stop that vomiting and also that feeling of nausea that is coming from the area of the throat. And also allow a lot of saliva that sometimes is accumulated here in the area of the throat due to the pregnancy, also to calm it down and relax it. So we'll go into showing you where these points are located. So taking out my drawing board. Whoever's been with me in the last sessions have seen that I've been using this drawing board quite a lot. So first of all, I need my hairline, okay, because we're going to start with the D point. Okay, the natural hairline of the patient. Okay, now this point is actually, if we have the hairline, now this point, the D point, is located approximately 1 centimeter above the zygomatic bone, and it's on the anterior hairline. That's one way to look at it. The next way is to say it's on the anterior hairline, the midway between the outer canthus of the eye. So we have the outer canthus here, okay, and the root of the ear, the midway in the height, the midway between the two. Okay, so in between the two areas there, that's where the D point is located. So D point is right here, and it'll be sensitive, okay, when palpation, and the needle in depth is going to be about half its soon, maybe sometimes a bit deeper, because we have a lot of the temporalis muscle, so we have an area which you can needle deeply here. The next point is the E point. The E point is located in the area which is a superciliary ridge. The superciliary ridge is if you feel your eyebrow and just go pop up just above the eyebrow, you feel that you're in a crest here. And that crest is what is called the superciliary ridge. And it integrates right around bladder 2, the line of bladder 2, into the glabella area, okay, of the frontal bone. So it starts from the, if we go into that notch, we go pupil line, okay, from the pupil line. So like I said, it's about 1 centimeter above the eyebrow, and it goes inwards. It's a 2 centimeter oblique line, okay, that goes medial. And then around the line of bladder 2, that's where it ends. So here will be thoracic 1, and this will be thoracic 12. Okay, so in between you have the whole area of the thoracic spine in between, but it's also, like I said, all the area of the chest. So you're going from the upper part of the chest, and slowly think about it that you're going down. What you do is a lot of times you look for the most sensitive point. It's not that you thread the needle right through the whole line. You look for the most sensitive point here, and you just needle the sensitive point. For your patients, you can just tell them to massage this point. And even if you know, even when we massage it, we know that gallbladder 14 has an effect in calming down axis in the upper region of the body. So it will also calm that down. Gallbladder 14 is slightly above the lateral part of E. So that's thoracic spine. Next point is the area of the eyebrows. So of the area of the throat. So it's all this region here around between the eyebrows, okay, and the nasal bridge. Intan is just above here. So it's slightly below intan, in between the eyebrows and the nasal bridge. Now this is the region, like I said, it's going to treat any disorder of the throat. I use it a lot in the hospital, which I work with in the rehabilitation department, a lot of people that are tube fed. So it helps them to stop being tube fed. The rehabilitation of the area of the throat You can use it for a lot for losing your voice, laryngitis, and any effects here, or vocal cord cysts, itchiness, irritable area. It's good for the thyroid, the parathyroid glands. So it's everything located around the area of the throat. So that's that throat point. So again, we have R, which is E point, which is called E point. Okay, we have throat point, and we have D point. So these 3 points, you can send the patient home with a press stack or even massager points. They're very, very, very effective in treating that those symptoms of morning sickness. Oh. So with that, I'd like to say thank you for attending this webinar. Short talk. I hope you found this useful and you can use it in your clinic immediately. If you have any questions, you can contact me by pneumac.com. That's my website, or my email, pneumac@gmail.com. Thank you very much. I'm David Bobson. Have a good day, a good week. Keep safe, all of you.